Military washouts gravitate to nursing because they can't handle real medicine. That is what Dr. Whitfield said 48 minutes before the Pentagon sent 2 agents to St. Michael's Hospital in Atlanta. He had no idea. Nobody in that hallway had any idea who they were standing next to. Ashley Cooper moved through the ICU at 6:19 a.m. like a ghost in Navy scrubs, the kind of invisible that takes training to perfect. She'd spent 18 years becoming unremarkable, fluorescent lights buzzing overhead like angry insects, the sharp scent of antiseptic cutting through recycled air that tasted like copper and bleach, her hands moving with a kind of methodical precision that came from muscle memory deeper than conscious thought. Room for 47 was hers this shift. Staff Sergeant Marcus Webb lay sedated in the bed, post-operative, 36 hours out from surgery for shrapnel injury sustained in Fallujah 6 weeks prior. His combat badge sat in a plastic belongings bag on the bedside table, pinned to a folded uniform, partially hidden beneath a stack of get-well cards from people who didn't know what he'd actually survived. Ashley's eyes caught the badge for exactly half a second. Long enough to register it. Long enough to recognize the specific unit insignia. Long enough to know that this patient mattered in ways the hospital staff would never understand. Then her face smoothed back to neutral and she checked his vitals with movements so economical they looked like a choreographed dance, fingers finding the pulse point at his wrist, the other hand already reaching for the chart, eyes scanning numbers with the intensity of someone reading classified documents. 84 beats per minute. Oxygen saturation 96%. Temperature 98.2. Pain score 4 out of 10. Everything stable. Everything documented. She changed his for line without waking him, the movement practiced enough that the new bag hung from the hook and connected to the port in less than 90 seconds, her hand steady as a surgical laser. The dressing on his left side, the worst of the shrapnel wounds, required attention. Ashley pulled the old gauze back carefully, noting the surgical site with the clinical eye of someone who'd packed worse wounds under considerably worse circumstances. The technique she used was older than most medical textbooks. 3 points of anchor, a specific moisture gradient, a packing density that prevented the wound from sealing prematurely while it healed from the inside out. A technique called remedy packing by the 17 people in the world who'd learned it under combat conditions. She'd invented half of it herself, at a field hospital operating table with 300 kilometers of hostile territory between her and the nearest air support. The scent of clean gauze mixed with the faint copper undertone of healing tissue. Her fingers moved, and the wound was repacked in 4 minutes flat. That's when the doors opened. Dr. Whitfield entered with 5 residents trailing behind him like pilot fish, his white coat somehow immaculate despite the early hour, silver hair perfectly combed, the kind of presence that made the fluorescent light seem a little dimmer by comparison. He was 58 years old, had worked at St. Michael's for 14 years, and had never been questioned about a single decision in his department. The cardiac ward was his kingdom. Everyone understood the hierarchy. He noticed Ashley immediately, the way a predator notices movement in tall grass. Interesting technique, he said, not to Ashley, but to the residents clustered around him. He stepped closer to the bedside, close enough that Ashley caught the scent of expensive cologne cutting through the antiseptic smell, something that probably cost more than her monthly rent. That's not the standard protocol, is it? Ashley finished securing the last corner of the dressing without looking up. Wounds healing from the inside out, doctor. Needs 3-point anchoring to prevent premature epithelialization. She spoke the words the way someone might read a weather report, factual, clear, utterly devoid of emotion. The residents shifted. Whitfield's jaw tightened. He was the kind of man who'd built his entire identity on being the smartest person in every room, on having the final word on every clinical decision, on the unspoken understanding that nurses followed doctors' orders, period. The kind of man whose authority was his oxygen. What I meant, Whitfield said, each word carved like ice, is that the protocol, the hospital protocol, the one established by the physician staff, calls for a different technique. Perhaps you learned something different wherever you worked before, but here at St. Michael's, we follow established procedures. He turned to the residents with a thin smile. This is actually a perfect teaching moment. Nurses who exceed their scope of practice can create liability issues. Good intentions don't matter if they violate the care guidelines. He paused, letting that land like a stone in still water. Watch to see how she adjusts her approach. Ashley secured the last piece of tape and stepped back from the bedside. Her hands didn't shake. Her jaw tightened, just barely, just enough that the muscle in her left cheek worked once, but her face remained a flat, professional mask. She pulled off her gloves with a crisp snap, the sound loud in the sudden silence, and turned to face Whitfield with eyes that gave absolutely nothing away. The dressing is secure, Doctor. Vitals are stable. I'll monitor the wound every 4 hours. She said it the way someone reads a script they've read 1,000 times before, competent, deferential, the performance of a nurse who understands her place in the hierarchy. Whitfield nodded, satisfied. See how she accommodates feedback? That's what professional responsibility looks like. He turned back to the residents and moved toward the next room. Come along. Let's look at the post-op MI in for 49. Ashley stood motionless at the bedside for 3 seconds after they left. She looked down at the combat badge on the nightstand. Then she looked at her hands. Then she walked toward the supply closet, moving with the precision of someone who still had 12 hours of her shift left and had learned long ago how to separate what happened in the world from what happened inside her own chest. The supply closet was narrow, stacked floor to ceiling with gauze rolls and 4 bags and plastic bedpans, the fluorescent light flickering in a way that made the space feel like the inside of a malfunctioning photocopy machine. Ashley closed the door behind her. She pulled the tarnished military challenge coin from her scrub pocket, tarnished by 18 years of wear, heavy with the weight of things that didn't have names. She held it in her palm, feeling the weight, watching the light catch its edges. Then she slipped it back into her pocket and took 3 breaths, the kind of deep breaths that came from understanding that the next 6 hours mattered in ways that nothing else in the building understood yet. She didn't cry. She didn't tremble. She didn't allow herself the luxury of anything that even resembled weakness. When she emerged from the supply closet, she'd already become invisible again. The rest of the morning was routine, medication administration, vital sign checks, the endless documentation that filled 3/4 of a nurse's actual shift. By 10:36 a.m., Ashley had completed her rounds, filed her charts, and was standing at the vending machine on the 2nd floor, waiting for her coffee. She needed the caffeine the way some people needed oxygen. She needed the 15-minute break from being someone else. That's when Whitfield rounded the corner with 2 interns, both of them young, both of them still new enough that they thought their supervisor's opinions had weight. "Ah, Cooper," Whitfield said, his voice carrying the specific tone of someone who'd been planning this moment since rounds. "These residents were asking me about career paths. I was just telling them about the unfortunate tendency of military personnel to gravitate toward nursing." He positioned himself at the adjacent vending machine, not actually getting anything, just standing there while he spoke loud enough for the interns to hear clearly. "You see, certain individuals leave the military and realize they couldn't handle the pressure of actual medicine, decision-making, real responsibility, lives in your hands." He paused, letting that statement breathe. "So they become nurses. It's a lateral move, really. Still in the medical field, but without the weight of actual diagnosis and treatment decisions." The interns laughed. It was the kind of laughter that sounded rehearsed, the kind that was more about aligning themselves with power than finding anything actually funny. Ashley retrieved her coffee from the slot where it clattered down, the sound sharp in the sudden quiet. The plastic cup was warm in her hands. She looked at Whitfield with eyes that were absolutely, completely neutral, not angry, not humiliated, not even particularly interested. The kind of look a person gives a problem they've already solved. "Coffee's ready, Doctor," she said. It was the kind of statement that meant nothing and everything. She turned and walked back toward the ICU, her footsteps quiet on the tile floor, her shoulders straight, her limp barely noticeable at all. Behind her, Whitfield was already turning back to the interns, already resuming his narrative, already convinced that he'd established exactly the hierarchy he intended. He had no idea that Staff Sergeant Marcus Webb was still sedated in room for 47, still wearing the combat badge of a unit that had trained Ashley Cooper for 18 years, still waiting for the moment when everything he thought he understood about the woman in navy scrubs would evaporate like morning fog. What happened next changed everything. And it started with a monitor alarm at 11:16 a.m. She returned to Webb's room at 11:52 a.m., chart tucked against her ribs like armor. The Ranger lay in the standardized hospital bed, eyes half closed, morphine drip steady at 3 milliliters per hour. His foresight was clean. His dressing held. The monitors breathed their mechanical rhythm, beep, 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 the sound of a man still tethered to this world by chemistry and luck. Ashley began the routine, vitals check, notation of drainage color, assessment of surrounding tissue for infection markers. Her hands moved through the motions with practiced efficiency, each touch economical, each observation documented. She was halfway through the wound inspection when Webb's voice surfaced through the haze, barely audible but coherent enough to stop her cold. "You packed wounds in Ramadi." His eyes found hers. "I've seen that 3-point clear before." The room stilled. The monitor's beeping seemed to amplify. Ashley's hand paused for exactly half a second, a microfracture in composure that lasted just long enough for her to feel it, then seal it shut. She completed the dressing assessment, fingers moving with deliberate precision, as if the question hadn't landed. As if a barely conscious Army Ranger hadn't just identified a technique that belonged to exactly 3 people in the Western Hemisphere. "You need rest, soldier," she said quietly, her voice descending into the low register she reserved for crisis situations. "The morphine is doing its job. Let it work." She adjusted his foredrip though it needed no adjustment, giving her hand something to do besides tremble. They didn't. Her jaw remained level. Her breathing stayed measured. But inside, beneath the practiced calm, something had shifted. The recognition in his eyes wasn't accidental. Webb had been in Fallujah. Webb had seen military field medicine up close. Webb understood what 3-point combat packing meant, understood that it required training, experience, and deployment to a theater where improvisation with a shrapnel wound meant the difference between a soldier walking out or being carried out in a flag-draped case. She left the room with her chart held at her chest like a shield. The hallway stretched before her, fluorescent lights humming their electric monotone, linoleum tiles clicking under her shoes, the distant sound of a call bell chiming 3 rooms down. She walked past the main nursing station without acknowledgement, past the supply area, and into the small utility closet where they kept the sterile dressings and irrigation solutions. The door swung shut behind her with a soft pneumatic hiss. Alone. Finally alone. Ashley leaned her back against the metal shelving, the cold edge of a steel shelf pressing between her shoulder blades. Around her, boxes of saline solutions and compression bandages created a fortress of institutional mundanity. The fluorescent panel overhead flickered, once, twice, casting her face in and out of shadow. She allowed herself 3 slow breaths. That was the protocol. That was the limit before control became suspicious even to herself. The first breath came in through her nose, holding for a 4 count, releasing through her mouth. In through the nose. Hold. Out. The second breath followed the same rhythm, her chest expanding against the stress of the moment, her diaphragm engaging like a bellows. The third breath was the deepest, the one that touched something primal in her spine, the muscle memory of a training exercise 15 years old, before she was anyone's nurse, before she was anyone at all except a person learning to compartmentalize fear. Her right hand drifted to her scrub pocket. The challenge coin was there, tarnished silver the color of storm clouds, worn smooth from 18 years of being carried. The edges had been dulled by deliberate wear. She'd done that in her first deployment, stroking the coin smooth the way a chaplain might handle rosary beads. Combat badge imprinted on one side. Her unit insignia on the other. A memento from Ramadi that she should have destroyed months ago but hadn't. Couldn't. The coin represented a life that didn't officially exist. Master Chief Petty Officer Ashley Cooper, assigned to Naval Criminal Investigative Service Special Operations Unit, attached to JSOC Task Force 121 for 3 deployments. 14 months in Fallujah across 2 separate tours. 32 combat medical interventions. 2 IED exposures. 1 Medal of Valor they couldn't frame publicly because her official service record listed her as a logistics specialist. When she'd been transferred to St. Michael's Hospital 3 months ago, the coin came with her, the only physical proof of what she actually was beneath the RN credentials and the Atlanta nursing license. Her mission parameters were clinical in their precision. Monitor Staff Sergeant Marcus Webb for intelligence on a weapons trafficking ring operating through veteran networks. Webb had survived an IED that didn't add up. His scars suggested exposure to ordnance that didn't track with standard Iraqi insurgent capability. Her handler suspected the weapons came from a source stateside, funneled through military channels, tested in theater, then brought back. The pattern pointed to someone with access to military procurement networks. Someone with institutional power. Someone like a department head who controlled narcotic dispensation and had 17 years of untouched security clearances. Someone like Dr. Whitfield. She'd been at St. Michael's for exactly 92 days when she identified the pharmaceutical diversion. The cardiac department's controlled substance inventory showed discrepancies that didn't appear in official audits, a gap of exactly 14% month over month, always in the most potent medications, always during Whitfield's shifts. The hospital's internal auditing system was automated, which meant the gaps were real enough to show in the data but small enough to avoid triggering oversight flags. 14%. Enough to supply a trafficking network with high-grade painkillers. Enough to keep a pipeline open to Afghanistan and back. Enough to support arms dealers who needed chemical leverage to move inventory through markets too fractured for normal supply chains. Webb was supposed to be a witness. A link in the chain. A ranger who survived because the IEDs testing those weapons failed catastrophically in theater, but who'd seen the supply chain, remembered names, could identify patterns. But the morphine was keeping him sedated, and her cover was disintegrating like wet paper, and now Whitfield was asking questions about why she spent so much time with one patient, and she'd allowed herself to get emotionally invested in keeping the ranger alive when she should have been treating him as an asset. The supply closet felt smaller now. The shelving pressed inward. Ashley closed her eyes and let the moment pass. She had training for this. She had protocols. She had 18 years of compartmentalization. The coin pressed against her palm. Still warm from her pocket. When she opened her eyes, her composure had been restored. The pulse in her neck had normalized. Her breathing had settled into the steady rhythm of someone who'd learned long ago that emotion was a luxury reserved for people who weren't deep cover. She returned the coin to her pocket, squared her shoulders against the weight of everything that wasn't being said, and opened the supply closet door. The hallway was still there. The monitors were still beeping. The hospital continued its operation indifferent to the fact that a Master Chief Petty Officer was walking its corridors in scrubs, pretending to be exactly what everyone assumed, while carrying the truth in her pocket like a ticking bomb. But that wasn't the worst part. The worst part was that she'd made a mistake. She'd allowed her hands to reveal something her voice couldn't cover. Webb knew. And if Webb knew, it was only a matter of time before someone with institutional power figured it out. Before Whitfield connected the dots between her sudden interest in the ranger, her superior medical skills, and whatever investigation might be running in the background, an investigation Whitfield himself was likely already aware of, already working to obstruct, already weaponizing his 17 years of clearance and institutional trust to dismantle. Ashley returned to the medication dispensary and began pulling the afternoon doses. Her movements were automatic now, her mind already recalibrating. She had to contact her handler. She had to accelerate the timeline. And most critically, she had to keep Webb alive long enough to talk, because if the ranger died before he could testify, the entire operation collapsed. She was running out of time. And more dangerously, she was running out of cover. The chart lay open on Ashley's lap in the break room, Staff Sergeant Marcus Webb's full admission file, not the sanitized version that Rounded had seen. She'd photocopied it during her lunch break, the machine humming in the deserted records basement at 1,247 hours, alone with fluorescent lights and the smell of old paper stored under sealed concrete. The shrapnel wound patterns in the admission photos told a story Dr. Whitfield's surgery notes had carefully avoided. 3 distinct entry sites. Lateral dispersal consistent with IED fragmentation. The angles, the depth, the metallurgic scarring, all signature weapons from the 2007 Fallujah engagement zones where the 1st Battalion, 5th Marines had operated that summer. Webb wasn't just any Army Ranger. He was a witness. She traced her finger across the medication administration record, her eyes narrowing. Something was wrong with the numbers. Webb's pain management schedule showed documented narcotic administration at 0600, 1200, and 1800 hours. Morphine sulfate, 4 milligrams for push. Standard postoperative dosing. But the pharmacy dispensation log showed 13 vials of morphine sulfate issued to Webb's room during his 7-day stay. 13. She did the mathematics again. 7 days. 3 doses per day should equal 21 milligrams total. The pharmacy had issued 52 milligrams. 4 times the prescribed amount. The discrepancy sat between the lines of official documentation like a scar beneath skin. The coffee from her 0800 break had gone cold beside her. She didn't touch it. Instead, she opened her tablet and cross-referenced the narcotic logs against the medication administration times, pulling up the digital timestamps that the hospital system maintained in encrypted archives. Most nurses never thought to look. Most nurses weren't trained to verify inventory reconciliation the way the Navy demanded. She'd been signing off on controlled substance accountability for 18 years. She knew what diversion looked like. Webb's room was not the only one. She pulled up 3 other patient files, all male, all veterans, all admitted with combat trauma injuries. Respiratory distress from shrapnel wound complications. Acute myocardial infarction post-deployment. Spinal cord injury from IED blast. The pattern was identical. Prescribed doses of 4 to 6 milligrams. Pharmacy dispensations of 40 to 60 milligrams. The difference signed off by a single nurse on night shift, a woman named Rebecca Thorpe whose digital signature appeared on every discrepancy report. Which meant Rebecca Thorpe either didn't exist, or she'd been dead for 3 years. Ashley pulled the HR database. Hired 7 years ago. Terminated 6 months before her death for voluntary resignation. No forwarding address. No exit interview. Just erased. The connection crystallized in her mind like blood crystallizing in a cold room. Dr. Whitfield wasn't just stealing morphine. He was using veteran patients as his cover. Their documented pain, their visible injuries, their lack of family members willing to argue over medical decisions, they were the perfect mask. Nobody questioned a wounded soldier's need for opioids. Nobody audited the doctor who treated them with special compassion. The veterans weren't entirely innocent in the machinery, either. Some of them were likely selling the extras, which meant Whitfield's trafficking ring didn't need external distribution. The drugs moved through the hands of the men themselves, carried out in their discharge bags, sold on the street to feed addiction or fund recovery. The beauty of it was its invisibility. The tragedy was its scale. Ashley closed her tablet and pressed her hands flat against the break room table. Her breathing stayed even. No surge of adrenaline. No tremor in her fingers. This was how she'd been trained to process threat assessment, clinical, methodical, stripped of emotional reaction. She had been sent to monitor Webb for intelligence on a weapons trafficking ring operating through veteran networks. She'd assumed the weapons were the target. She'd been wrong. The weapons were the symptom. Whitfield was the disease, and he'd infected the entire hospital's supply chain. Which meant someone higher than Whitfield had to know. Which meant this wasn't a single doctor's criminal opportunism. This was an operation. The break room door opened. Nurse practitioner Diane Mitchell walked in, already loosening her stethoscope from around her neck. She didn't notice Ashley sitting in the corner, tablet dark against her lap. Diane was one of the good ones, 15 years at St. Michael's, real integrity, the kind of medical professional who actually believed the Hippocratic Oath meant something. She poured herself coffee from the pot Ashley had brewed at 0600, steam still rising from the glass. The new admission's vitals are weird, Diane said, not to anyone in particular, just talking out loud the way nurses do when they're processing information. 2-year-old with dehydration, but the 4 orders are specifically requesting Whitfield to oversee the line placement himself instead of delegating to the resident. That's unusual. He usually makes the junior doctors do the work. Ashley didn't move. She didn't acknowledge the comment. Diane finished her coffee and left, her footsteps padding down the hallway toward the pediatric ward. A 2-year-old. Whitfield was now targeting pediatric patients. The implication was so dark that Ashley had to grip the table edge to keep her hands from moving. A 2-year-old couldn't question narcotic administration. A 2-year-old couldn't complain about unusual dosing. A 2-year-old's parents would believe any medical explanation for why their child needed pain medication. The trafficking ring hadn't just expanded into the veteran population. It had expanded downward, into the most vulnerable patients in the hospital. She stood, her movements controlled and deliberate. Her shift started in 13 minutes. Webb would need his 1,300 hours vitals checked. She would observe his vital signs, his cardiac rhythm, his oxygen saturation, and she would do what she'd been trained to do, remain invisible while gathering intelligence. But now the intelligence had changed. Now she wasn't just monitoring a single patient for information on a weapons network. Now she was documenting a systematic narcotic diversion operation that reached from the pharmacy to the bedside to the streets of Atlanta, moving through the bodies of wounded soldiers and sick children as if they were nothing but commodity vessels. She sealed the photocopied charts inside the waterproof envelope she kept in her locker, the same envelope that contained her military ID, her security clearance documentation, and the tarnished challenge coin from her final deployment. The coin was bronze-colored ones, issued to every member of her SEAL team during the 2006 rotation. It had been in her pocket the day the IED detonated under the Humvee in Anbar province, the day she'd carried Webb 2 kilometers with a punctured lung, the day that shrapnel had carved parallel lines across her left ribs and she'd kept moving because stopping meant dying and Webb was still breathing and breathing meant fighting. Her phone buzzed. Text message from unknown number, shift change at 1400. Whitfield in surgery until 1500. Webb is clear. Move fast. Ashley didn't recognize the number. She didn't know who had sent the message. Which meant someone inside the hospital network already knew she was working the intelligence angle. Which meant she wasn't the only one investigating Whitfield. Which meant the operation went higher than she'd initially assessed, high enough that Navy intelligence was coordinating with assets on the ground before she'd even filed her first report. She deleted the message, the phone screen going dark. Then she walked out of the break room toward the ICU, her posture perfect, her expression neutral, her hand steady as surgical steel. The fluorescent lights buzzed overhead like 1,000 insects trapped in glass. The hallway smelled like antiseptic and fear. And somewhere in the building, Dr. Whitfield was finishing his valve replacement surgery, completely unaware that he was standing at the center of a federal investigation that was about to fold him into evidence. Webb's monitor beeped softly when she entered his room, the heart rhythm steady and regular, the oxygen saturation holding at 96%. She checked his chart, updated his vitals, and positioned her body between him and the doorway in case anyone was watching her work. Then, in the space of 40 seconds, she photographed every page of his medication administration record with a camera concealed inside her watch face. The technology was basic by modern standards, but it was reliable. And it would hold the evidence she needed. The real nightmare was just beginning. The monitor screamed at 1,340 hours. Heart rate climbing, 120, 130, 140, the numbers ascending like a countdown. Ashley was checking vitals on Marcus Webb, routine shift, her hand steady on his wrist when the beeping accelerated into a panic. Blood pressure dropping. 68/40. His eyes flickered open, confused, the ranger's jaw clenching as his body registered what his sedated mind couldn't articulate. Muffled heart sounds. The kind of quiet that meant fluid was crushing his heart like a fist closing. Cardiac tamponade. Pericardial effusion. Webb was drowning in his own body, one needle puncture away from arrest. Ashley didn't call for help. Not yet. Her hands moved on their own, the kind of muscle memory that comes from 9 combat deployments and 200 emergency field procedures. She gathered the supplies in her left hand without breaking stride: sterile tray, the 18-gauge needle, iodine swab, 50 cubic centimeter syringe. The movements were economical, precise, zero wasted motion. A resident named Chen was 2 beds away. She made eye contact and spoke in the voice of someone asking for salt at dinner. "I need you to monitor his O2. Call respiratory. Do it now." Chen moved. No one questioned the tone because the tone was command. The needle went in at the 4th intercostal space, just below the xiphoid process, at a 45-degree angle. 18-gauge angiocath needle pushing through skin and muscle and pericardial membrane. The hiss of air escaping. Blood dark as motor oil filled the syringe, old blood, accumulated pressure, the reason his heart was failing. 60 cc 80 cc. 120 cc of fluid that had been suffocating him. O2 sat climbing on the monitor. 82. 88. 94. Sinus rhythm stabilizing, heart rate dropping from the panic back to something survivable. Webb's breathing eased. His eyes closed but his jaw unclenched. He was going to live. Ashley withdrew the needle and applied pressure with a 4x4 gauze, her left hand still holding the syringe of blood that had just been his death sentence. That was when Dr. Whitfield arrived, pulled from whatever conference or consultation had been occupying his morning, his face registering the scene in increments, the emergency equipment scattered on the bedside table, the aspiration needle still visible in Ashley's steady hand, the resident standing back with his arms crossed, the monitor showing a heart rate returning to normal. Whitfield's expression shifted like a cloud crossing the sun. Calculated. Cold. The look of a man who had just watched someone exceed their authority in the most undeniable way possible. "What exactly are you doing?" His voice was flat, rhetorical, the kind of question designed to establish dominance rather than seek information. Ashley didn't answer because the answer was obvious. Instead, she disposed of the needle in the sharps container and turned to Chen, cardiac team. Chest X-ray to confirm fluid reabsorption. "We'll need imaging within the hour." She made notes in Webb's chart with the same composure she'd used 6 minutes earlier when she was the patient care technician responsible for vitals and nothing more. Dr. Chen, the attending resident, spoke up, "That technique. Where did you train?" That was textbook field medicine. Ashley's pen didn't pause. "Critical care certification. Online coursework." Whitfield cut between them like a blade. "Dr. Chen, a word." They stepped into the hallway. Through the open door, Ashley heard Whitfield's voice drop into the register he used for teaching moments, the tone that made residents pale. "What you witnessed was a nurse performing a procedure outside her scope. Dangerous. Unauthorized. That's how people die." The door closed but the damage was already done. Ashley finished her charting and moved to the supply closet, not to cry, not to fall apart, but to document what she'd witnessed in the narcotic logs. The investigation was accelerating. Whitfield's overreach on the pericardiocentesis was a secondary concern. The real threat was the medication diversion she'd traced to his signature on controlled substance requests. The real threat was systematic theft from patients like Webb. But the real threat had just locked eyes with her, and Whitfield's fury had a name: career protection. Within 2 hours, the network activated. Ashley watched it unfold from the periphery, a sequence of phone calls made from Whitfield's office with the door closed, his voice muffled but his intent crystalline. First call, the hospital board chairman, intercepted and referenced in hallway conversation between 2 administrators passing the nursing station. They mentioned country club, Thursday golf game, concerns about liability. Second call, her nursing school at Emory. A staff member mentioned his name when Ashley checked her mailbox that afternoon. Whitfield had requested her full academic file, incident reports, any disciplinary notes from her clinical rotations. Third call, an outside investigator contracted to review her credentials, a firm called Sterling Risk Assessment, already en route from their downtown office. The chess pieces moved. She was the rook. Whitfield was the king defending his territory. Ashley was in the break room when security arrived at 1510 hours. Two officers, one older with a department-issued radio and a surname badge that read Palmer, the other younger, nervous. Palmer held an envelope thick with official hospital letterhead. "Ms. Cooper, I need you to come with me." It wasn't a request. It was a command. The suspension letter was waiting in the HR office, Dr. Whitfield's allegations printed in clinical language that transformed life-saving intervention into dangerous overreach. The board chairman had signed it. Her access badge was deactivated immediately. Her shift was terminated effective immediately. An investigation would determine whether she could ever return to nursing at St. Michael's. The letter included language about patient safety, scope of practice violations, and the hospital's legal obligation to protect vulnerable populations. The irony that she'd just saved one of those vulnerable populations seemed irrelevant. They wouldn't let her return to Webb's room to explain. Palmer escorted her to the locker room where her scrubs hung on the same hook they'd occupied for the past 6 weeks. Ashley changed into civilian clothes, jeans, a grey Henley, the kind of outfit that didn't broadcast anything, and then performed the one final task that mattered. She folded her scrubs with military precision. Each crease exact. Corners aligned at perfect 90-degree angles. The sleeves folded so the seams ran parallel. She held the folded bundle in her hands for 3 full seconds, then placed it in the hospital laundry bin with the same care someone might use to fold a flag. The tarnished challenge coin from Fallujah sat heavy in her jeans pocket, the metal worn thin by 6 years of thumb runs, a nervous habit from midnight watches in desert compounds. She stood alone in the locker room, fluorescent lights humming their electronic prayer, her jaw tight, her breathing controlled. The mission was compromised. Webb was unprotected. The investigation into narcotic diversion was incomplete. She walked out without looking back. That evening, her handler called. The voice was secure, filtered through layers of encryption, the kind of communication reserved for assets in the field. Extraction in 48 hours. Mission abort. Ashley didn't respond immediately. She sat in her apartment, a sparse-furnished rental in Midtown with furniture that looked like a hotel catalog, and let the silence answer for her. "Confirm receipt," the handler said. "Over." "Understood," Ashley said quietly. "But the mission isn't finished." "It's finished when we say it's finished." 48 hours. The line went dead. She didn't sleep that night. Instead, she sat by the window and watched Atlanta's skyline pulse with reflected light, her mind cycling through variables, Webb's recovery, Whitfield's timeline, the evidence she hadn't yet collected, the extraction parameters that would pull her out of the city before the federal investigation she'd been conducting reached critical mass. The next morning came gray and flat. Ashley went to St. Michael's business office to collect her final paycheck, a procedural necessity, something normal people did when they left jobs. She stood at the counter filling out exit paperwork when the ER doors burst open like a percussion shot. Paramedics wheeled in a trauma, a man in his 50s with a face that looked like geography, all scars and angles, his body rigid on the gurney, his eyes wild. He was shouting in Arabic, combat boots visible beneath the trauma pants, his voice raw and broken and terrified. The paramedics rushed him past the business office toward Trauma Bay 3. Then he locked eyes with her. Everything stopped. Not the physical movement, the paramedics continued, the trauma team mobilized, the hospital's machinery of emergency response continued its choreography, but the space between them crystallized into a single moment of mutual recognition that felt like a gunshot in a quiet room. He went rigid on the gurney and screamed in English, "Cause Kuza! Cause Kuza!" The medic from the Fallujah Bridge. "Cause Kuza! Rainbow!" The Arabic call sign from an operation 6 years ago, from a black site location outside the Jolan district, from an enemy combatant she'd treated after a firefight before intelligence extracted him for interrogation. Now he was here. In her hospital. In Atlanta. Saying her name. Ashley moved toward the trauma bay on pure instinct, but a voice stopped her. The voice belonged to the veteran security guard stationed at the ER entrance, Palmer, the same one who'd escorted her out. He was studying her face with the careful attention of someone who'd seen classified operations firsthand. Navy anchor tattoo visible on his forearm. Eyes that had looked at things that couldn't be unseen. "What's your actual rank?" he asked quietly. The hallway seemed to compress. Two orderlies froze. A nurse stopped mid-stride. Palmer's question hung in the air like a challenge coin spinning, waiting to land. Ashley made a choice in that moment, the kind of choice that couldn't be unmade. She met his eyes and spoke clearly, her voice dropping an octave from the timid nurse who folded scrubs 8 hours earlier. "Master Chief Petty Officer, United States Navy." Palmer straightened immediately. His right hand came up against his chest in a salute so sharp it sounded like a crack in the silence. "Room, attention!" 3 other veterans snapped up, the orderly near Trauma Bay 2, the janitor who'd been pushing a cleaning cart, another nurse who'd been charting at the station. They all moved to attention simultaneously, a synchronization that only came from military training, from muscle memory spanning years or decades. Footsteps echoed down the hallway. "Where is she?" A woman's voice. Command authority. The kind of vocal presence that reshaped air pressure. Vice Admiral Patricia Hendricks rounded the corner in service dress uniform, 2-star insignia catching the fluorescent light like a promise or a threat. Behind her, 2 naval officers in full dress whites, their uniforms so crisp they looked like they'd been cut from steel. The Admiral's boots, black leather, polished to a shine that reflected the ceiling lights, struck the linoleum with measured precision. Dr. Whitfield emerged from his office 30 feet away, confused, irritated at the disruption. His mouth opened to demand an explanation, but the Admiral didn't acknowledge him. She moved directly to Ashley like a missile finding its target. "Master Chief Cooper. You're out of position." "Yes, Mission compromised," Ashley replied. The Admiral held open a personnel file, her voice carrying through the emergency department with the weight of testimony. "Ashley Marie Cooper. Master Chief Petty Officer. Naval Special Warfare Combat Medic." One of Whitfield's residents gasped audibly. 12 combat deployments. Fallujah, Ramadi, Helm and Province. Whitfield had gone pale. The color drained from his face like water from a bath. 3 Bronze Stars. 2 with Valor device. An orderly whispered something that sounded like prayer. Purple Heart. Navy Cross for actions on November 7, 2004. The room had become a church, and Ashley was becoming something other than what they thought they'd known. Embedded Deep Cover Operator, NCIS Joint Task Force, investigating pharmaceutical diversion pattern suspected at this facility. Whitfield's resident, the one who'd laughed at the vending machine, stepped backward slowly, his face showing the exact moment comprehension arrived. That was when Marcus Webb emerged from imaging, conscious now, clear-eyed from reduced sedation. The trauma tech wheeling him stopped when he saw Ashley and the Admiral and the officers in their dress whites. Webb's voice cut through the silence like a blade. "That woman took shrapnel meant for my convoy. Carried me 2 clicks with a punctured lung. I wouldn't be here without Rainbow." 10 seconds. The room held 10 seconds of complete silence. The heart monitor from Trauma Bay 3 beeped steadily, the only sound in a space that felt like it was holding its breath. The Admiral turned to Dr. Whitfield with the precision of a sniper acquiring a target. "Doctor, can you explain why you terminated a decorated Master Chief Petty Officer who was conducting a federal investigation into narcotic diversion in your cardiac department?" Whitfield's mouth opened and closed. The goldfish expression of a man drowning in air. There was no indication, her credentials showed. Her credentials were cover. Her mission was monitoring pharmaceutical theft. The Admiral's voice didn't rise. It didn't need to. You just obstructed a federal investigation and attempted to discredit a federal agent through institutional abuse. 2 FBI agents in dark suits stepped from behind the Admiral's escort. One of them addressed Whitfield with the tone of someone reading a foreclosure notice. "Sir, we need you to come with us." Security knocked on the hospital administrator's office door at exactly 2:17 p.m., their shoes clicking against linoleum like a countdown clock. Ashley sat in the chair across from him, her hands folded in her lap, watching the guard hand over a sealed envelope. The administrator wouldn't meet her eyes. "Suspension pending investigation," he read, his voice the texture of sandpaper on silk. "Immediate surrender of your hospital badge and building access credentials. Security will escort you to retrieve your personal effects." Ashley took the envelope. She didn't open it. She simply nodded once, the gesture precise as a salute, and stood to leave. The staff locker room was empty at 2:43 p.m. Shift change meant everyone was in report or already gone. Ashley opened her locker and looked at the scrubs folded on the shelf, the one she'd worn for 93 days of perfect undercover work. She pulled them down and held them for 3 seconds, then began folding them with the same parade ground precision she used to maintain weapons in the field. Fold. Crease. Fold again. No trembling. No hesitation. The fluorescent lights hummed their mechanical song above her, and she moved through the motions like a soldier disassembling a rifle one last time, muscle memory, controlled, inevitable. She placed the folded scrubs into the laundry bin and reached into her pocket, feeling the weight of the tarnished military challenge coin from Fallujah, the one she'd kept hidden beneath her socks. She held it for a moment, the metal cold against her palm, then slipped it back into her pocket. Her cover was burned. Her mission was incomplete. And in the silence of an empty locker room, Ashley Cooper allowed herself exactly 5 seconds to acknowledge the cost before closing her locker door for the last time. But that wasn't the worst part. The next morning, she walked through the hospital doors at 8:09 a.m., dressed in civilian clothes, jeans and a grey jacket, to collect her final paycheck from payroll. She was halfway through the corridor when an ambulance bay door burst open and voices crackled across the overhead speaker, "Incoming priority trauma, shrapnel wounds, vitals unstable." The stretcher wheeled through, paramedics calling out blood pressure and respiratory rates, and then the patient's head turned toward the hallway. His face was a map of scars, Fallujah scars, the kind that came from IED fragmentation, thin white lines like a story written in pain. Their eyes locked across 30 feet of hospital air, and the man's jaw went rigid. He sat up against the paramedics' protests, eyes locked on Ashley's face, and his voice came out hoarse but certain, switching from rapid Arabic to English with the precision of someone who'd just remembered which language would reach her, cause Kuza. The medic from the Fallujah bridge. "I know those hands. Cause Kuza. The rainbow." That had been her call sign. That had been 3 deployments ago. A veteran security guard, Navy tattoo visible on his forearm, the kind that came from decades of service, stepped forward and looked at Ashley directly, his eyes sharp with sudden recognition. He said quietly, just loud enough for her to hear, "What's your actual rank?" The hospital corridor seemed to hold its breath. A nurse glanced up from her cart. 2 residents paused mid-conversation. Ashley met the guard's eyes and spoke in a voice that had suddenly dropped an octave, the mask sliding away like water off oil. "Master Chief Petty Officer. United States Navy." The silence lasted exactly 2 seconds. Then the guard's posture shifted, straightened, shifted, became formal. He reached for his radio and said 7 words that changed the entire atmosphere of the hospital. "We need command presence in this corridor." Vice Admiral Patricia Hendricks arrived at 8:33 a.m. in service dress uniform, blues sharp enough to cut, her presence filling the corridor the way a tank engine fills a garage, steady, heavy, impossible to ignore. She carried a file folder and moved with the authority of someone who'd commanded thousands of warriors. The administrator appeared beside her like a satellite pulled into orbit. 3 residents materialized near the elevators, watching. The head nurse stopped pushing her medication cart. The Admiral opened the file and read aloud, her voice carrying the weight of official record, "Ashley Marie Cooper. 12 combat deployments." She paused, letting that settle. 3 Bronze Stars. Another pause, longer this time. The residents' faces were changing, recalibrating. 2 Purple Hearts. and a Navy and Marine Corps Commendation Medal for operations directly related to this location's narcotic diversion investigation. The Admiral looked up from the file and directly at Dr. Whitfield, who had emerged from his office and stood frozen halfway down the corridor, his face draining of color like someone had unplugged him. Master Chief Cooper was conducting a federal investigation into controlled substance diversion perpetrated by this department's leadership. She saved her patient's life yesterday. She also documented everything. Staff Sergeant Marcus Webb, the Ranger patient, was being wheeled into the trauma bay, but his voice carried clear and certain down the hallway. She took shrapnel meant for my convoy in Fallujah. Carried me 2 clicks with a punctured lung and a dislocated shoulder. That was 6 years ago. Yesterday she did it again, saved my life when the doctors froze. The Admiral turned to Whitfield, and when she spoke, each word landed like a hammer strike. Why did you terminate a decorated Master Chief Petty Officer conducting a federal investigation into your department? Whitfield's mouth opened. Nothing came out. The silence was thick enough to perform surgery in. At 9:15 a.m., 2 FBI agents arrived with a warrant and walked directly to Whitfield's office. Security footage showed them photographing his computer screen where Ashley's personnel file lay open, fabricated performance violations typed in, dated in the past hour, evidence metadata stamped into digital existence like a confession written in real time. They found printed narcotic logs in his desk drawer, discrepancies highlighted in yellow, pharmacy invoices with pharmaceutical company letterheads, and detailed notes about which shifts had the least observation. The agents walked him out at 10:33 a.m. in handcuffs, past the residents who'd laughed at the vending machine, past the nurses who'd feared his authority for years. His face was the color of old concrete. Ashley stood in the hallway in her gray jacket, her hands at her sides, her expression exactly what it had been the day she took the pericardiocentesis needle from his hands. Nothing. No satisfaction. No anger. No relief. Just the quiet composure of someone who'd learned long ago that victory and burden often wore the same face. A resident approached her with guilt written across her features. "I'm so sorry. I didn't know what you were." Ashley nodded once, the gesture small and final. "Neither did he," she said simply. 6 months later, she walked through a strip mall in civilian clothes, carrying coffee from a chain cafe, and past a storefront with a folding table visible through the window. A handwritten banner read, "Cut rate insurance, no credit check, all applicants considered." Behind the table sat Dr. Whitfield in a polo shirt, talking to an elderly couple about liability coverage. His medical license was gone. Federal charges had resulted in probation and community service. But the humiliation was permanent. Ashley paused for half a second, made eye contact through the glass, watched him recognize her and look away first. She kept walking. That was enough. At Naval Special Warfare Command Headquarters in Coronado, 6 weeks before the strip mall encounter, Ashley stood in dress whites as Vice Admiral Hendricks pinned the Navy and Marine Corps Commendation Medal to her chest. The citation was read aloud by the Admiral herself, for exceptionally meritorious service during a joint task force operation resulting in the disruption of a multi-state pharmaceutical trafficking network and the protection of veterans from exploitation. Staff Sergeant Webb stood beside the Admiral in his dress uniform, one arm still moving with the careful precision of healing. The ceremony lasted 7 minutes. The photograph lasted longer. In her new office at SOCOM, training combat medics, her cover assignment complete, her mission now openly what it had always been covertly, a shadow box hung on the wall containing her polished challenge coin and a photograph of the ceremony. The coin caught afternoon light through the office window, the tarnish removed, the edges clean. On her desk, a plaque read, "The ones who have seen the worst often give the most." Ashley sat at her computer reviewing files for her next assignment, hand steady, expression calm. Outside her door, young medics passed by, and one whispered to another, "That's Master Chief Cooper. She's a legend." Ashley didn't hear it, or if she did, she didn't acknowledge it. She simply continued her work, quietly, competently, heroic in the way that mattered most. She closed the file on her screen, stood, and walked toward her classroom where a new generation of combat medics was waiting to learn how to hold people together under fire. The challenge coin remained on her desk, catching light, telling its story to no one and everyone at once. When you know the truth, sometimes the most powerful thing you can do is simply keep walking. Subscribe for more stories about the quiet warriors among us.